All right, everyone. My name is Zach. For those of you who don't know me, I am an occupational therapy student and also a certified lymphedema therapist. Today, we're going to be talking about navigating oral health challenges. It's going to be a comprehensive guide with adaptive solutions for movement disorders. What I'm going to do first is I'm going to give you a handout. This will occur later on in the slides. It's oral motor exercises. We're all eventually going to participate in them, so I'm going to do that first. One more.
Thank you.
There you go.
You want me to just pass them down for you?
Sure.
Here, use that.
Should that be good? 1, 2 here.
We just
1, okay. How about you?
Exactly, buddy.
Very welcome. Here you go. Here you go. And there you go. Perfect. You want to? Yeah. Oh, here you are.
Yes, physical therapy, what is that? That's something that's a paid thing.
Right here. Oh, you got one.
That's gonna be.
Got a couple? I'll take that.
I think he
One
has
more?
parts here. He does take
You
medication.
want one? I'm sorry. Here you go.
Have some insurances, but you'd have to set it up through him. Actually, I have a flyer for him right in front of me. If you can't find his card. And then he's gonna do it in this little room right behind us.
Okay.
And he does
Hey,
one on,
Candace, if you can hear me, could you please mute? Thank you.
Terrific.
yeah.
Thank you.
Yeah, we got it. Perfect. All right, did everyone get one? Good to go? Okay, perfect. All right, we'll get started. So this is just our agenda for the day. We're going to have an introduction. That'll be first. Then we're going to get into our adaptive techniques and equipment. We'll move on to our oral motor exercises, which I just handed out. And then we're going to talk about some healthy foods that contain xylitol. We'll get into that in a little bit. Some recommendations for you, both for dentists and also for pharmacists. And we'll have a summary at the end. Also, if you have any questions, feel free to stop me. If you have one pertaining to a particular slide that I'm on at the time, if not, we'll have an open discussion at the end. Last time I presented this with some students from Kaiser. We had a group of 4 here, and we had an open discussion at the end that led to some helpful tools. I think that would be great. Maybe we can do something like that. All right. So the introduction, here just to provide education and resources on oral care to maximize oral hygiene in people with movement disorders through supplies, routines, enhancement opportunities. So we'll start with our adaptive techniques and equipment. So 4 key talking points here. We want to look into adjusting our posture. Posture. You hear it all the time. Why is it so important, right? Well, it's linked to any functional activity, right? The slouching, yes. If you have poor posture, think about while you're eating or while you're brushing your teeth. If you're drooped over, you have more likeliness to drool or to drop food items, things of that sort. When you're brushing your teeth, maybe spilling some of the toothpaste that's on the toothbrush. We're going to talk a little bit about proximal stability. We're going to talk about our oral motor exercises and why they're important, and then also to utilize chewing gum. So to start out, I want to talk about a recent study that I found. And the study was performed on the impact that oral motor exercises and adaptive tools had on improvement in oral hygiene in individuals with moderate to late stage Parkinson's. So the participants all had moderate to late stage Parkinson's. That's important to remember. There was 29 participants of the study. 86% of them reported that they performed oral motor exercises 4 to 5 times a week over the course of 2 months. 69% of the participants reported regular use of something we call a Dr. Barman's toothbrush. I don't know if any of you are familiar with this toothbrush. I do have it in one of my later slides if you're not, so we will cover that as well. What's important about this study, though, are the results. Out of the results of the study, there was an opening jaw capacity increase of 6% over 2 months. Sounds like a small number, but that's pretty significant over a short period of time. What does jaw opening capacity do? That helps you reach all surface areas of the teeth when you're brushing, things of that sort. It could also help increase chewing times as well. Over this study, chewing times were increased by 49% just by the oral motor exercises alone. That's very significant. Also, there was a significant reduction in plaque deposit buildup over time, just because you're able to reach more surface areas, things of that sort. When you're chewing more often, you have a reduced risk of the buildup of bacteria in the mouth that could eventually lead to things like aspiration pneumonia. So adjusting our posture. When you're engaging in your oral hygiene, it is important to maintain an upright posture. And to do this, you should either sit or stand upright. You want your chin up, shoulders back. Perfect. Just like you would in any normal setting when they say adjust your posture, you always think, get those shoulders back, keep that chin up, right? So this, like I said before, it'll help reduce drooling. It'll help keep food items in your mouth, things of that sort. When you're brushing your teeth, it'll help the drooling, especially when you have toothpaste in your mouth, the saliva buildup, things of that sort. Proximal stability. What is proximal stability? So that is getting closer to your work area, being more what we call proximal to, let's say, the sink when we're brushing our teeth, right? I like to think of it, it's going in and out, there we go. I like to think of it as kind of like getting right up in your work area. So you want to have those elbows and forearms really propped up. So if you like to sit down while you're brushing your teeth, you can while you're standing up too. Really get leaned over like so and keep everything close, what we call proximal. And this should in return help with coordination issues. I don't know why that's going out. There we go. Okay. So oral motor exercises, as discussed in the previous study, oral motor exercises have been proven to be very beneficial in improving overall oral hygiene in individuals with movement-related disorders. Performing oral motor exercises daily has a variety of benefits, as we discussed. The jaw opening capacity, reaching all surface areas of your teeth, improving flossing. When you can open your jaw wider, you can floss better. Also, oral motor exercises can help improve swallowing of food items, and decreased ability to swallow your food items may lead to that aspiration pneumonia just because the bacteria build up. Utilizing chewing gums, this could also be using xylitol candies, so not really the sugary, but sugar substitute. Swallowing difficulties can also lead to aspiration pneumonia, along with oral motor exercises. For improved swallowing, you can use chewing gum or other sweets that contain xylitol. Using the chewing gum or sweets tells your brain that you have something in your mouth, and it'll help you swallow more often. Swallowing more often will also help reduce the buildup of saliva in your mouth over time. And I know there's medications that do this as also. I'm not going to go into a discussion of that particularly, but that's just something to think about. Next, we have some adaptive tools that we could use, or just general things that may help in the long run. The first one is what we call MI paste. Oh, sorry. There we go. So the MI paste is not a substitute for toothpaste or anything in your regular routine. You would also just use it as an addition. This contains calcium and phosphate, which help remineralize your teeth if you're used properly on a regular basis. So the acid produced in your teeth eventually cause breakdown and cause cavities. MI paste just helps fight that. That's all it is. Yes. An electric toothbrush? Good question. I have a version of the electric toothbrush in here, but yes, that is better use. The circular motion, it kind of takes away from you having to create the circular motion. So if you have fine motor coordination issues, electric toothbrush will solve that one aspect for sure. Very good to use. When you're using the MI paste, you want to use it after brushing your teeth, flossing, and using mouthwash. Generally, dentists will say to keep it in your mouth for about 30 minutes so you don't apply it and then rinse like you would mouthwash, things of that sort. You keep it in your mouth. You can use a mouth guard to fill up the mouth guard with MI paste, or you can just apply it with a finger. That'll work as well. Cover all surface areas. I had one person that's a member here that told me they use it often and they really like it. What they do is they will keep it in their mouth overnight. So that'll help fight that bad bacteria and plaque buildup that occurs overnight. This right here is simple, just a dental floss pick. They're much easier to use for a variety of reasons, right? Compared to regular floss picks are easier to grip, are single-handed use, they're more stable, and reduces the demands in terms of fine motor control when compared to your regular floss. Oh, sorry. There we go. So y'all seen this, right? Yes.
Listening
Cheap,
to a
too.
program
Cost efficient.
about Parkinson's and oral health.
Oral health.
Yeah.
Okay, this right here is the Dr. Barman's toothbrush. I don't have one on me, but it is actually a triple bristle. So there are bristles on the two sides and one right in the middle. And this toothbrush will cover all surface areas of the teeth at once. So instead of having to go get the front of the teeth and then the back of the teeth, this will eliminate the time required and the fine motor demands required to do so. So you can get this in electronic form, so then that takes away the rotational component as well. This was used in that previous study, which we discussed all the added benefits for that, right? Not too expensive, $8 for the standard one, $30 for the electric one. You can find it right off Amazon.
What's the name of it, Zach? I'm sorry.
It's okay, Dr. Barman's toothbrush. Yep. So that'll be right there, BARMANS. Also, I have a list of some of this equipment that we're talking about, and I'll pass that out too in just a little, okay? So you should have that on the list. This right here, they're called Zollipops. This is just one of the xylitol-friendly sweets, candies. You can use it as a sugar alternative. Stimulates saliva production, neutralizes acid breakdown of teeth, and helps balance the pH levels in your mouth, like any xylitol product would. All right. This right here, I actually have a couple versions of right now. They're weighted wrist cuffs. So this is supposed to help reduce the amplitude of tremor. So it doesn't necessarily take away tremor, but it reduces the frequency that the tremors occur. I'll show you the right now. Sorry. So this one, you just place on your thumb, wrap it around the wrist, and attach with the Velcro piece, and it'll stay on your wrist just like this. I find this next one a little bit more helpful, especially when you're doing fine motor tasks. This is a heated hand cuff. So again, apply on the thumb piece first. Wrap it around. Like so. Just keeps going out. There we go. And then there's finger slots. You just pull right over. So I've used both with someone before. I just kind of wanted to see what they liked better. They also chose this one and preferred this one over. Probably, if I had to guess, probably where the weight is distributed. That you use it on top of the hand. All right, next we're going to talk about an automatic toothpaste dispenser, a cheap alternative. You don't have to unscrew the cap to your toothpaste anymore. So yeah, you just place the toothpaste right above, stick it in the automatic toothpaste dispenser, stick your toothbrush under, and there you go. You got some toothpaste. I will say this could be a little bit messy sometimes, especially if you don't hear the sound of the toothpaste being dispensed. So you want to be aware of that. But you could see why it's helpful, right? Takes away the demands of having to work with a toothpaste, spilling it all over the countertops and stuff of that sort. This right here is a water pick. Do any of you own a water pick? Yes, lots of you. Good. This covers all surface areas of the teeth. Much user-friendly alternative to floss, I would say. It's gentler on the gums than floss, actually. Yeah, and it can be used comfortably with people with sensitive teeth. Yeah, that picture is not the best, but if you've seen one before, you know what it is for sure. It's a little bit more expensive, though. I will say that. It is kind of pricey, but you can find it at Walmart, Amazon, and Target. There's a lot of them around. This is a built-up handle. So foam grip handles, they're very cheap. You can get them at places like Walmart or Amazon. I have a couple here. So they come in full length, and they come in different sizes and diameter here. And you just basically choose the size that would fit your tool. So I have the red one here. This is what fits a toothbrush best. And this makes it so where you don't have to grip or grasp that small, tiny, little thin frame of the toothbrush. You have an easier grip. So it relates to less dropping of the tools, that's for sure. All right. Next, we're going to get into our oral motor exercises. So this is the part that we all get to participate in, a little interactive from the... There we go. Okay, so everyone get out their paper that I passed out earlier. It'll be this one here, good. Okay. So we're going to do a few of these. We're not going to do every single one. There's some that require a tongue dispenser. I didn't have any tongue dispensers to hand out today, but they are similar to some that we are going to do, so you can kind of get the gist of what you're supposed to do with the tongue dispenser. So we start off with our jaw exercises. This one is going to be our jaw opening. You're going to open your jaw as wide as you can until you feel a stretching, but no pain. Stay away from pain. Hold this furthest open position for 5 seconds and then relax. So we'll go ahead and open up. And relax. Good. We'll do it a few times. Open up. Relax. Good. Open up. And relax. Very good. Next, we're going to do a side-to-side jaw movement. So you're going to move your jaw to the right side as far as you can, and you're going to hold it there for about 5 seconds and then relax. After that, you go to the left side. So you're alternating, right? So we'll go to the right and hold for 5 and relax. Go to the left. Good. And relax. To the right. Relax. To the left. And relax. So I'm sure we've done a few of these. If you come to the speech group classes as well, you might be familiar with some of them. All right, next is the increasing circular jaw movement. You're going to move your jaw around in a circle, making it move as far in each direction as you can until you feel a stretch but no pain. In this circular movement, you will increase the range of motion in all directions. When you have completed a full circle, you want to relax. So go all the way around the world. And when you're back to the middle, you just relax. Okay? All the way around. And relax. One more, all the way around. And relax. Very good. Y'all are pros at this. Can't forget the tongue. Next, we'll do tongue exercises. This is our range of motion. So you're going to start with tongue extension. You're going to protrude your tongue between your lips, sticking it out as far as you can. You're going to hold that steady for about 3 to 5 seconds and then relax. So tongue out all the way. Back in and relax. Tongue out all the way. Back in and relax. Let's do one more. Tongue out. Back in and relax. Very good. Next is called tongue retraction. Everybody on that one? Good. So we're going to retract our tongue now, which means bring it back. Touch the back of your tongue to the roof of your mouth. You're going to hold it for 1 to 3 seconds, relax, and repeat. So we're going to touch the back of your tongue to the roof of your mouth. And relax. Good. Again. Relax. Good. One more time. And relax. Very good. All right. Next is tongue tip up. Place the tongue on the...
or a doll and you can't find it?
And how do you want me to stand?
Oh, hard to understand? Okay. Sorry about that online. I know you don't have a list of the exercises either. I apologize.
You gotta see it. I can watch the news.
No.
All right, we'll continue. So for this one, we're looking at the area behind your top teeth. That's called our alveolar ridge, okay? So behind the top teeth. If you don't have any teeth, that'll be a problem, but you can move your tongue tip up to your gum where your top teeth would be, okay? You're going to open your mouth as wide as possible while maintaining tongue contact. So you start with the tongue at the top, open up, hold, and relax. Good. Again, up, relax. Do one more, and up, and relax. That one might take some practice. All right, number 4, tongue side to side. Tongue tip to the left side of the mouth, like so, and you're going to hold that for 3 to 5 seconds, okay? And go. And relax. Now we're going to alternate. We're going to go to the right now. So to the right. Relax. Back to the left. Relax. And to the right. Relax. Very good. All right. So next is our tongue resistance. We're gonna skip that one. That one is some of the exercises that involves that tongue dispenser. In your free time, I do encourage you just to read over it. It's got good directional information on this page. We're going to go into our lip exercises, okay? So first one is called lip retraction. This one's quite easy. All you have to do is smile, and you're going to hold that for 5 seconds, and then you're going to relax, okay? Let's do it. Go ahead and smile. And relax. This one's my favorite one. It shows that you guys are liking this so far. All right, go ahead and smile. And relax. One more time, go ahead and smile. And relax. Good. This next one's lip protrusion, like you're giving someone a kiss. So pucker your lips up. Hold for 5 seconds. Go ahead. And relax. Pucker up. Relax. One more time. Pucker up. And relax. Very good. Again, all these say repeat 5 times. I would encourage you when you're doing it in your normal routine to follow what it says here. If you find that they're easy and you can do more, feel free. But for now, I'm just giving demonstration. So we're only doing 2 to 3. All right, now this is going to be a combination of what we've done from the previous 2 exercises. It's lip retraction and protrusion. So we're going to start by smiling and then into the pucker your lips. Good. And smile. Pucker your lips. And smile. Pucker your lips. Very good. All right, we have this next one is lip closure exercises. So we're going to press tightly, your lips tightly together, like so. And you're going to hold for 5 seconds. And relax. Good. All right. Hold for 5 seconds. Relax. We'll do one more. Hold for 5 seconds. And relax. Very good. Number 2 is using a tongue depressor. We will skip that one. We're going to go into number 3, where we're going to puff our cheeks out. So you're going to fill cheeks with air, move air from one cheek to the other 5 to 10 times. So alternating. Very good. Nice job, everyone. And that is the end of the oral motor exercises. So yes, I would say daily would be appropriate. 5 to 10 times. It says 5 on the paper, but if you're feeling brave, I would go for 10 each exercise. All right, this is just a little slide of healthy foods or healthy foods for oral care. It's xylitol containing foods, fruits, vegetables, and grains. There are many more than this. Okay, I took that out. Good. They do contain xylitol, but they don't contain a lot of xylitol. It's not a significant amount. However, it could be an alternative to kick those sweet cravings. I would try them out. Spinach, kale, apples, carrots, celery, pears, kiwi, onions, and sweet potatoes are just a small amount of these foods. I would encourage you to research more into what other foods contain xylitol and also which contain more than others. That would be a good opportunity. If you want, you can go ahead and write these down. If not, we can move on. I don't have a handout for this one, I'm sorry. Oh, also towards the end, if anyone wants this whole PowerPoint, if you just shoot me your email, I can send this whole thing over to you as well. Just catch me at the end for that. All right, good. So this next topic is communicating with specialized oral healthcare providers. A couple of tips. There's more than that's just on this slide. I'll read off the rest too, but our first tip is do not be afraid to advocate for yourself. That is the most important one. Whenever you're dealing with anything in healthcare, always advocate for yourself. Sometimes dentists, doctors, they don't get the full picture. If you don't tell them about these things and your concerns, they might skip over them. I would say that's probably one thing that all of you should just look out for if you have an individual or you yourself are experiencing these things. Just advocate, 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 advocate. Next, you want to prepare a list of questions. I do have some questions that are example questions after this slide. And the list of questions will be something you provide to your dentist or doctor, and that should help clear some things up as well. That goes hand in hand with the advocacy for sure. Number 3 is be confident. Be confident of your strengths and limitations. Know what you know, right? Number 4 is find providers that are willing to work with people who have movement disorders. There are some dentists that specialize in individuals with movement disorders. So I would really look into who you have now as your dentist and if there are other ones out there that might be more suitable for you. Number 5, make a list of the strengths and weaknesses. So that goes hand in hand with number 3. Create that list, know your strengths and limitations, and then, be confident about them. Number 6, have a discussion with the dental office prior to the appointment to discuss how Parkinson's disease or other movement-related disorders may affect the appointment, such as tremors, rigidity, difficulty speaking, anxiety, things of that sort. Number 7, also be sure to bring up specific issues being experienced like dry mouth, excessive drooling, things of that sort, as the dentist can help address them as well. Tip number 8, provide a medication list to the dentist that will ensure that the risk of medication interactions is kept low when you're with your dentist at that time. Tip 9, I would request a 45-degree incline to the dentist chair if you're not in that position already. Also I would ask for extra suction to assist with the saliva production and swallowing issues if you're experiencing that. Tip number 10, if possible, schedule the appointment during your peak on time. So we all know when we're feeling best throughout the day, right? I would schedule an appointment around that time. It's generally a window, so maybe like, a 2-hour window. I would plan for that. Here are some example questions for your dentist. First one is, what can I do to improve my oral hygiene? I'm sure they'll give you a whole list. Are there any areas that I could do a better job getting to when I'm brushing my teeth? What would you recommend that I do differently in my oral care routine? And here's some questions of what to say when you call them. Hi, I was wondering if you guys provided care for people with movement disorders. It's important. Does your office work with people that have movement disorders? If not, do you know of any places that accept people with movement disorders in this area? And also, that one's a little cut off. Would you be able to compensate for me if I'm unable to get into the dentist chair? That can be a problem sometimes. All right, these are some of the specializations in the dental field. I'll go over them briefly. First, we have periodontists. They specialize in prevention, diagnosis, and treatment of gum disease of teeth including periodontal disease, which is our gum disease, and periodontitis, which is gum and bone disease. So if you're experiencing that, I would recommend you check into our periodontist. Next, we have our general dentist that specializes in neurological disorders. They'll have a better understanding of challenges that come with movement-related disorders, including mobility, tremors, and oral care coordination. We also have our prosthodontist. They specialize in the restoration and replacement of teeth, including dentures and dental implants. So if you need something of that sort, that is the specialization you'd want to seek out. They may be particularly helpful if Parkinson's has affected your oral function or if you have difficulty with dentures. Then we have dental subspecialties. This will be our geriatric dentists. They generally work with the geriatric population. We have our general dentists, and they are just the umbrella. They cover all aspects of treatment, diagnosing, and managing of your overall dental health. Here we have a pharmacist recommendations. It's best to only have one pharmacist. That's if you're going to multiple pharmacists, say you're going to this one off Clark, you're going to this one off Bee Ridge, that could create a little notch in the care. Maybe they don't see what all medications that you're taking, and they could, because doctors do miss that. They do. It's just, one of those things. But if you only have one pharmacist and they can catch that in time, you won't be taking medications that might interact with each other in a negative way. One pharmacist will help with the greater consistency in care. They help with quicker decision making without the need to consult with other pharmacists, so they're not talking back and forth. Could take days, weeks, you never know. And also that rapport. Rapport is always important in healthcare field. Building a stronger bond with that pharmacist helps you trust them. In return, that will help them provide better care towards you. This right here, I'm going to pass out now, along with the adaptive equipment list. This is, it's cut off, but this is an accountability checklist. And I made this with the intention to hang in your bathroom or somewhere handy in order to provide a mental checklist daily that you can go through. And it goes over strategies and techniques as well as some of the adaptive equipment that we discussed here today. So just some reminders here. Did you brush today? Did you brush after every meal? Did you use toothpaste with fluoride or special MI toothpaste? Did you floss? Did you perform your exercises? Were you able to stabilize your arm when performing oral hygiene tasks for better control? That's the postural stability or proximal stability. Did you use the xylitol suckers or any xylitol alternative? So that's basically what this list is for. It's a mental reminder. Sometimes we need that. This right here is the adaptive equipment that we talked about. This is the handout that's coming after. And the summary. As an occupational therapist, it's my role to assist individuals with movement disorders and their family members by educating them on preventative care strategies to reduce the risk of oral hygiene-related issues. Providing preventative strategies can be successful when the individuals are given specialized oral care, oral exercises, and foods that are healthy for your oral care. We cover it all. There's my references.